Hello, my name is Heidi Wittenberg, and I wanted to go over some Vagina 101 issues for especially skin grafting vaginas or vaginas from the penile inversion technique. For the third visit with my patients, I usually go over this conversation for long-term care issues that you should be aware of. So first of all, you'll always need to dilate. If you do not dilate, you will lose your depth. And the only way to regain that would be another surgical procedure, which at this point would probably be peritoneal pull-through or colon option. So don't let anybody other than your surgeon tell you not to dilate. If dilation becomes difficult, a lot of times we recommend going down in size and dilating more frequently. You can always regain width, you just cannot regain depth. So always dilate. Long term, I know after a year we say dilate once or twice a week. If your partner or toy is as deep and as wide as your vagina, you could replace potentially the dilation with those. But I think it's just preferable to keep a separate dilating regimen because it is variable, partners' depth. And also their length and width. And we'd rather really make sure your vagina remains stable. The second really common issue is vaginal care with vaginal discharge and douching. A cisgender vagina tends to be pretty acidic with a pH of 4.4. A skin grafting vagina tends to be pretty basic, a pH of 7.0 or neutral. So we will need to kind of reacidify the vagina with douches, which are acidic, one to flush out skin cells, and to kind of the smuts of leftover from the water-based gel you're using for dilation, to flush out any kind of buildup of those materials. And also, when the pH becomes more basic, bacteria tend to overgrow. And with that growth, they tend to have an odor. It tends to be a fishy odor. So if you're noticing a more fishy odor, you need to up your douching regimen. So baseline is once to twice a week is recommended. You might be confused because in the world of GYN, women have been told not to douche, but that is usually because a natal pH of 4.4 should hold bacteria and yeast in check, and sometimes douching upsets that pH. However, a skin grafting vagina tends to be basic and needs to be reacidified. So we do want you to douche because we don't have with the skin lining, the self-cleaning oven effect that natal lining has. So we have to artificially reproduce that with the douching. And any douche tends to be acidic, whether it's over the counter or using apple cider vinegar. All those are all acidic. Even hydrogen peroxide diluted, 1 tablespoon in a cup of water is, again, acidic. So that being said, if there's still a fishy odor, sometimes even natal vaginas have pH imbalances, is you can insert a boric acid capsule vaginally, which keeps the pH acidic. And that can last 3 to 7 days to keep the pH acidic, and those are easily accessible on places like Amazon. So boric acid capsules, 400 or 600 milligrams, 1 tablet placed vaginally after douching will last 3 to 7 days. That being said, if you're continuing to have discharge or issues, you absolutely need to go see your provider to check for infection or any other issues going on. There are some rare instances that hair might be growing, and they can pluck out some hair that might be contributing to the pH imbalance or other infections depending on your history. So again, if this doesn't resolve, you need to go see your local provider. Okay, so the other really basic Vagina 101 thing we need to bring up is bladder infections or urinary tract infections. With the changed anatomy, a shortened urethra now is more accessible to bacteria, and because of that, women are more susceptible to bladder infections. So symptoms like going to the bathroom more frequently, and when you go, you don't have as much urine in, or when you empty, you feel like you haven't emptied, you're still full. Another symptom can be burning in the urethra when you urinate, or blood in your urine. So if you have any of those signs, you should call your primary care or gynecologist, usually with your pharmacy number, your name, date of birth, allergies. Tell them you have a urinary tract infection, and they'll either call in some antibiotics for you or have you come into the office for a urine culture. The other thing that comes up more immediately post-operatively, but women sometimes complain about spraying when they urinate. Now, this is really common immediately post-operatively because of the swelling that occurs, but a little education, like 100% you're going to have more spraying when you pee, just because the urethra is inset, the opening is a little bit more open, and also the labia are directly in the way of the stream. So spraying is common, which is why women have to sit down on toilets. So don't be scared if spraying occurs when you pee. That's actually quite natural. However, if urine is getting caught in a fold, in a kind of a posterior fold, and dribbling out after you pee in a large amount, that you're kind of soiling your underwear or your undergarments, pants, or dresses, maybe contact your provider. So that is usually my third post-op visit Vagina 101 discussion, and hopefully it helps.